Hello, today I'm going to talk to you about tetanus, and the reason why I chose to do my project on tetanus is because it seems everyone in the health field, whether you're in the hospital setting or a clinical setting, or if you're emergency services such as fire EMS, everybody seems like they require you to have a tetanus vaccine or the booster shots periodically before you can enter these programs or you can work at these facilities unless you sign a decline sheet. So a little bit more about tetanus as we go along here. Tetanus is also called or termed lockjaw. That's due to the effects that it has on facial muscles, and we'll dabble more into that as we go along throughout the program here. The tetanus pathogen is Clostridium tetani. They are gram-positive rods, as you can see in the picture over here on the right. The rods there, on the end of these rods, they have the spore end, but it's referred to as the drumstick shaped end. The spores on these ends right here are able to collect the bacteria as they come through, and that's how the bacteria get attached and move along throughout the body system when we're referring to tetanus. How the infection occurs. Tetanus occurs whenever there's bacteria from a contaminated source such as dirt or soil or unclean items. Typically we think about rusty objects like nails and stuff like that, or screws, puncturing the skin and causing a wound. Once the wound site is there, the bacteria enter through that. Environmental contact, such as like contact with these items, the dirt, the rust, the soil, they enter through that wound site and cause the contaminated bacteria to attach to the gram-positive rods and move through the body. Tetanus is not person-to-person contact. It's not communicable that way. Like everything has to come through a puncture site or through a wound. Contaminated bacteria, like we were talking about a minute ago, are rusty objects, dirty objects, wood burns, ulcers, people who are habitual drug users. Those sites can be a site for the bacteria to enter, for you to contract the tetanus virus. Also, the umbilical cord for neonatals and babies. Some cultures, the way they cut the umbilical cord is very unsanitary, and they use different practices in a lot of third world or undeveloped countries, and it allows for an infection to set in through the umbilical cord process of cutting, and this causes tetanus to be able to enter the body through the umbilical cord and affect the baby. Tetanospasm toxin enters in the body. These bacteria enter the body through the central nervous system, and they come through the peripheral nerves or through blood and attack the central nervous system. So here's kind of a breakdown of how it all happens. The wound is there from whatever, it may be a cut or a puncture. Somehow you've broken the skin, and that dirt or wood or burn or whatever it may be gives it a way to enter the body. Enters the body and enters the neurons to where it attaches to the gram-positive rods, drumstick end, and the bacteria take a ride pretty much on that end and travel through the body. Once they get in there, they affect the muscles of the body until they reach the spinal cord area. Once they reach the spinal cord area, those tetanospasm toxins bind to the nerves, and then they stop the neurotransmitter activity, and this causes the effects that you have, such as muscle spasms and contractions with the muscles, due to the neurotransmitter stopping the activity, and it does not allow for the normal movement to be there, and it causes great pain for the patient. Incubation period for tetanus is typically 7 to 10 days, but in some cases it can take up to a few weeks to present and be noticeable. kind of depends on your immune system and the body and how it enters your body. Like the next statement talks about, the shorter the incubation period, the more severe it usually is, and the further away that the site is that it enters your body, the more time you usually have, the closer you are to the central nervous system, the spinal column, where the wound's at, closer to that, makes it to where the incubation period is much shorter. Signs and symptoms of tetanus. Most people have at least a couple of these, if not all of these. The muscle spasms and cramps we were talking about a minute ago, due to the neurotransmitter not being able to function like it normally should. The jaw pain or tightening of the jaw, because the muscles in the face are kind of cramped up and they can't move like they normally can. That's where the term locked jaw goes back to, is the jaw tightening up. Weakness, fever, fatigues, sweating, headaches, difficulty swallowing, and in the more severe cases, irregular heart rates and breathing and respiratory issues. There's kind of a diagram of some of those different signs and symptoms, the fever and the blood pressure. In the severe cases, you can have broken bones just to the weakness and the fatigue of the body. I never really noticed that, but it's kind of ironic reading about that you can become so weak and fatigued that your bones pretty much break. Back spasms are another severe thing. These are images here of the back spasms that can be caused by it, and it's a severe reaction as noted in these pictures here. You can see that the back is kind of arched because it's so severe of a contraction of the muscles that you really don't have any control over yourself. In the severe cases, respiratory issues occur. This is due to like the muscle spasms and the muscles not being able to move like they normally can within the chest wall and the abdomen and the lungs and stuff like that. So therefore it causes respiratory issues. In these severe cases like that, a patient may have to be placed on a ventilator for a short time or even a long time. It depends on how severe their tetanus case is. Who's at risk? Who's susceptible to contract tetanus? Anyone who has a skin break or puncture or burn. Anyone who deals with animal feces or anything like that. Some third world countries, like we're talking about the neonatal stuff a little bit ago, in some third world countries, whenever they cut the umbilical cord, they actually put animal feces on the stump of the baby at the umbilical site. It's kind of a heritage thing that they've done for years, and this causes a lot of infection, and tetanus can enter the baby's body that way. People who have deep penetrating wounds from a dirty or rusty object, and people who haven't gotten their tetanus vaccine or their booster shot on the occurrence of every 10 years like they're supposed to get, those people have a weaker immune to the tetanus virus, and it's easier for them to contract it once they come in contact with these rusty objects or burns or punctures. Tetanus in neonatals. Neonatal is a baby, obviously a month or less. This is usually due to unclean or unsanitary cutting of the umbilical cord, like I was talking about a moment ago. Typically this is in undeveloped and third world countries that don't have the same sanitation processes that we have here. Types of tetanus. You have local tetanus, which is around the site of the initial entry of the wound, and it's usually gone in a short amount of time. Cephalid affects the head, facial muscles, the locked jaw issues that we hear about. General tetanus and neonatal tetanus are the two most common types. General can affect adults and children, and this is where the locked jaw starts with the facial muscles and then goes into the neck and then can progress on to where it causes respiratory issues in the long run. And then the neonatal we're talking about is typically due to some kind of unsanitary process of cutting the cord, or either the mother has the virus already or something and she passes it on to the child. Immunization with tetanus. Adults get their first dose. If they're an adult, if they never got it before, they'll get their initial dose and their second dose about 4 to 8 weeks apart. Once they get that dose, about 3 to 6 months later, they will have a third dose, and then every 10 years. And the adult vaccination is the Tdap, but you can see that the T is capitalized and the rest are lowercase. So the tetanus part of the vaccination, the immunization, is the strongest part of it, and then the diphtheria and the acellular is a reduced amount, so you get less of that, and you'll see the difference in the child dose. So the adult is capital T and then the lowercase DAP, the Tdap. In children, they get the DTaP, and the reason for that is the D is capitalized, as you can see at the bottom, and the T is capitalized. So they get a larger dose of the diphtheria, and they still get a large dose of the tetanus part, and then just a reduced amount of the acellular. And then children get their first dose at 1 to 2 months of age, and then 4 months of age, and then 6 months of age, and then sometime between 15 and 18 months, and then again in their elementary school years. And then they, just like adults, are supposed to get a booster every 10 years. Tetanus in pregnancy. They want you to get vaccinated during pregnancy just to get the Tdap. Supposed to get it in each trimester, hopefully, but at least once they prefer, and this helps keep the child from possibly having tetanus when they're born if the mother already has the virus in her. Vaccine reactions. The severe ones would be the hives, but the most severe would be anaphylaxis shock, or either the Guillain-Barré syndrome. With anaphylactic, it affects your breathing and your respiratory, and you'll have a decreased blood pressure, and it can cause you to pass out. So it's pretty severe when it comes to your breathing issues. With the Guillain-Barré syndrome, the same thing. It like starts in your toes and your feet as a tingling sensation, and then moves its way through the body until it affects the respiratory system and the muscles with it. So you maybe have to be placed on a ventilator if it's severe enough until these symptoms subside. Thank you for watching. Here are my sources. Appreciate your time, and I hope you learned something today.